Hi friends, in today's class we will discuss about the classical signs of keratoconus in our latest episode of Eye Insider Ophthalmology Simplified for residents. So we will discuss about the external signs, the slit lamp signs as well as the retroillumination signs. Okay, so coming to what are the external signs in keratoconus. So the first and the most popular one, as we all know, is the Munsons sign, in which when the patient looks in the down gaze, there is a V-shaped protrusion of the lower eyelid. So this is the Munson sign. So if we draw it as a diagram, we can see that when the patient looks downwards, there is a V-shaped protrusion in the lower lid. Now coming to the second sign, external, is the Rizzutis sign. So in this, when we throw a light from the lateral side of the eye, so it gets focused sharply over the nasal limbus. Understood? So when we throw a light on the lateral side, so what happens? This keratoconus cornea will focus it over the nasal part of the limbus. So we show it in a diagrammatic way. So the light is thrown from the lateral side and it is getting focused over the nasal limbus. This is the Rizzutis sign. So these are, we can see with our bare eye. Now coming to the slit lamp signs. So the first one is the Vogt striae. So Vogt striae are vertical lines which are seen in the deep stroma as well as the descemets membranes. So these are most commonly vertical, V for V, but it is most commonly parallel to the steep axis of cornea. Now it disappears on digital pressure. So if we apply a pressure with the digits, it will disappear. Coming to the second sign, it is the Fleisher snail. So let's remember that there is another case of Fleischer ring which we can see in the Munsons disease. So these are the iron deposition line. The Fleischer ring is iron deposition, whereas the KF ring is copper deposition. So you can go through the video described above to know more about this. So it is the iron deposition in a ring shaped at the base of cone. So it can be better seen with the cobalt blue filter as well as green filter. And coming to just to remember, there is another white limbal girdle of Vogt which we read in our previous class, that is corneal pigmentation as well as in the corneal degenerations. So we can go through that class. Next is the prominent corneal nerves. So these corneal nerves are there is increased visibility of this because of thinning of the cornea. The next sign is the corneal thinning. So as we know, it is the characteristic feature of keratoconus. So these are corneal ectatic disorders, right? So most commonly it affects the central or a little bit of inferior central part of the cornea. This can be best appreciated with the pentagram, that is corneal topography. Then this thinning can lead to apical scarring also. So this scarring of the cornea occurs in 20% of the cases, most commonly in the severe cases, and it can start as a fine line at the apex and progress towards formation of a nebular scar. Right? Next, the sixth sign is the rupture of bowmans membrane. So we have discussed that there is thinning, there is scarring, and then there is a rupture of bowmans membrane. We can remember it something like that. So by membrane, and then we have this rupture of descemets membrane, which is called as acute hydrops. So just mention in the comment box how do we manage the acute eye drops in keratoconus. So it occurs due to imbibition of aqueous into the stroma, which leads to swelling of stroma. Coming to the eighth sign, this is swirl or hurricane or vortex stain. So when we stain the cornea with a fluorescent strip, in case of a keratoconus patient who is not using a contact lens, there will be this swirl shaped, spiral shaped staining of the cornea because the epithelium slowly degenerates from the periphery to the center. So the epithelium gets slowly replaced in this way. So this is more characteristic appearance in keratoconus. Now coming to the retroillumination signs. So the retroillumination signs of keratoconus include, the first one is scissoring reflex. So this is a reflex which is seen on retinoscopy. So when we do a slit retinoscopy, instead of two lines which are perpendicular to each other, we can see it as a X-shaped or a scissor-shaped light beam, so which rotates on rotation of the retinoscope. Okay. Then coming to the second sign, that is all droplet reflex. It is seen on Placido's disc examination, and charleux sign. This is also the same, but it is seen on distant direct ophthalmoscopy. That is, the cone appears as a dark area in the eye, whereas the periphery appears a red reflex. So this is because the cone, because of its configuration, it appears a dark shade. Okay, so this was regarding the signs of keratoconus. If you have missed any signs, please do mention in the comment box below, and do subscribe to my channel because it's taken a lot of effort to create good videos. Thank you.